The following videos were designed for the American Lifeguard Association to give individuals the knowledge and skills needed to become a certified lifeguard. We will be performing various life-saving exercises throughout these videos to examine proper rescue techniques and victim care. Make sure to review the manual for additional information on rescue procedures.
In this situation, the victim will not have a pulse and will not be breathing. Their hearts will not be cycling blood throughout their body, and their lungs will not be giving them adequate amounts of oxygen. Because of this, we have to compress on their chest to act as if we were their heart, and give them breaths to act as if we were their lungs. For the adult, child and infant, we give them a combination of 30 chest compressions and 2 breaths. When performing compressions, we need to make sure we have proper position, proper compression rate, and proper compression depth. For the adult, child and infant, we're going to be compressing at a rate of 100 compressions in a minute. For the adult, we're going to be compressing down about 2 inches. For the child, we're going to be compressing down a little less, about 1.5 to 2 inches. And for the infant, we're going to be compressing down even less, about 1 inch. To achieve proper compression position for adult or child, place the palm of your hand in the center of the victim's chest and grasp it with your other hand. Have your knuckles off the victim's chest, elbows locked with your chest over the top of their chest. Compressing down about 2 inches, remembering to do 30 compressions, just like this. 1, 2, 3, 4, 5, 6. To achieve proper position on our infant, we're going to place one hand on the top of the victim's head and 2 to 3 fingers in the center of the victim's chest below the nipple line. Using the pads of your fingers, remember to compress down by about 1 inch, doing 30 compressions and 2 breaths.
When 2 rescuers are available, it's often good to perform what is known as 2-man CPR. This will help alleviate possible exhaustion as well as helping memory recall. When performing 2-man CPR on an adult, rescuer 1 will be located at the victim's head to give the victim breaths. Rescuer number 2 will be located at the victim's opposite side to give them compressions. We'll be giving the victim 30 compressions and 2 breaths. When performing 2-man CPR on a child, we'll maintain that same position, but we'll only be giving 15 compressions and 2 breaths. When performing 2-man CPR on an infant, rescuer 1 will be located at the head of the victim to give breaths. Rescuer 2 will be located at the victim's feet, giving compressions with their thumbs instead of their fingers. We'll be giving the infant 15 compressions and 2 breaths, just like the child.
No shock advised.
An automated external defibrillator, AED, is a crucial component of the cardiac chain of survival. Familiarize yourself with the standard precautions for its proper use. 1. Unpack the AED and power it on. 2. Clear the victim's chest of any obstructions that could hinder the AED pad attachment, such as clothing, water, or chest hair. 3. Attach the AED pad to the victim's chest without plugging them in yet. For adults and children, place the first pad on the upper right side and the second pad on the lower left side of the chest. 4. Connect the AED pads to the device once they are securely attached to the victim's chest. 5. Make sure you're not in contact with the victim. Verbally declare, "I'm clear, everyone stay clear," to prevent interference during the AED analysis. 6. The AED will analyze the victim's heart rhythm to determine if the shock is necessary. 7.
Analyzing.
Based on the analysis, the AED will indicate either shock advised or no shock advised.
Shock advised.
If a shock is advised, ensure everyone is clear and press the shock button. 8. If no shock is advised,
No shock advised.
perform 5 cycles of CPR before reanalyzing the heart. Remember, prompt use of AED along with CPR can significantly improve the chances of survival during a cardiac emergency.
No shock advised. Shock advised.
Conscious choking. In a case of a conscious choking victim, always remember to get consent and call 911 assistance if needed. If the victim is able to cough, stay with them and encourage them to keep coughing before doing the following steps. First, approach the victim from the side so that your chest is to their shoulder. Reach across their chest to the other shoulder and lean them forward slightly, right between their shoulder blades. Give them 5 back blows with the palm of your hand. 1, 2, 3, 4, 5. Next, come behind the victim and locate their navel, and make a fist right above it and grab it with your other hand to do 5 upward thrusts. 1, 2, 3, 4, 5. We continue the cycle of 5 back blows and 5 abdominal thrusts until the object is dislodged or the victim becomes unconscious. Conscious choking infant. In the case of a conscious choking infant, we must better secure the head and the neck. To do this, place your one hand and your forehand straight down their chest. Then place them down at a 40-degree angle on your knee. Right between their shoulder blades, we're going to give them 5 back blows with the palm of your hand, making sure not to make contact with the back of their head. 1, 2, 3, 4, 5. Once we've done the back blows, clamp them in and rotate them over the other leg, at which time we're going to give them 5 chest thrusts in the same position as CPR. 1, 2, 3, 4, 5. We continue the cycle of 5 back blows and 5 chest thrusts until the object is dislodged or the victim becomes unconscious. Unconscious choking victim. While rechecking our ABCs, if the first 2 breaths don't go in, remember to retail and try them again. If those 2 don't go in, it means the airway is still blocked. And we must follow 3 simple steps. Step 1. 30 compressions in the center of the victim's chest. Step 2. Sweeping out their mouth by grasping their tongue and sweeping it out with your finger. And step number 3, give them 2 breaths to see if the airway is clear. If those 2 breaths don't go in, simply repeat the cycle of 30 compressions, sweeping out the mouth and 2 breaths until the airway is clear. Don't forget, if the breaths don't go in, before continuing, attempt to retilt the head forwards and then back. This can be crucial in overcoming an obstruction due to the tongue falling back. Unconscious choking for infants. We follow the same steps when clearing an object from an unconscious choking infant. 30 compressions on the center of the victim's chest, sweeping out the mouth and delivering 2 breaths. Continuing that cycle of 30 compressions, sweeping out the mouth and 2 breaths until our breaths go in, at which time we'll know the airway is clear. In this situation, the victim will have a pulse but will not be breathing. Blood is being cycled throughout their body, but they're not getting adequate amounts of oxygen. Because of this, we have to give them breaths. For an adult, we give them 1 breath every 5 seconds. For the child and infant, we give them 1 breath every 3 seconds since their lungs are smaller. We continue this for a total of 2 minutes. At which time we'll recheck our ABCs to see if they still have a pulse and see if they are possibly breathing. Remember, each breath should last about 1 second. Don't empty out your lungs. Give it a normal breath for an adult, less for a child, and just a puff for an infant. If you breathe too much or too frequently, it may cause the victim to vomit. If this happens, simply tilt them to one side and sweep their mouth and continue with your breaths. When 2 rescuers are available, rescuer number 1 will be positioned at the victim's head, securing the mask. Rescue number 2 will be positioned at the victim's side, squeezing the bag to deliver the breaths.